Okay, so now we're going to look at how to do our charting on a patient. Now we can get into the patient's chart the way I showed you in the last video, but the easiest way to do this, because we're already set up in our task list for the triage, see our patient that we registered and put in room 7 from the ambulance earlier says triage needed over here. So if you click on your task list, it will show you your triage part 1 and triage part 2 are still here to be done. So we're going to click on those. We're going to do both of them. Click document down here at the bottom, and that will take you into this power form window. So again, yellows are hard stops. We're just going to chart just some random things here so that I can show you what happens. And this is stuff that we will go into further detail about during your department orientation. This would be a good point though where we could look at our medication history on the patient and our allergy history during our triage. This is where we want to put in a story about the patient so that before the provider even goes into the room to see them, they have a good idea of what's happening. So that short little explanation here, I feel like gives the provider a fairly decent idea of what might be happening. You're going to come down here, and a lot of this stuff it's not yellow like this chief complaint. It's not yellow, it's not a hard stop, but we should be entering it anyway. And this is stuff that, again, our preceptors are going to go through this with you during your orientation. I just want to give you a quick picture of what happens here. So then we're gonna obviously enter a set of vitals, even though none of that is a hard stop. Our measurements for adults, it's okay to put in an estimated weight and an estimated height. For all of our pediatric patients, we should always actually weigh them and measure them. This is an adult patient, so we're going to say 75 kilograms. And there's a height history in here. I usually will ask the patient just to make sure that whatever was entered on this last visit is accurate. We're going to say it was. This is your ESI triage window. So you have some guidelines over here about how we decide what acuity level this patient should be. So this patient, we're going to say no immediate life-saving intervention is required. This patient's fairly stable. Not a high-risk patient, short of breath, but vitals are stable. We're not on oxygen yet. And I'm just making up this situation as we go along. So we're going to say no to that. But we are probably going to use more than 2 resources. We're probably going to do an x-ray. We may do an IV and some fluids. We probably are going to give some medications. So more than 2 resources will automatically be clicking many, and it's going to tell us a suggested acuity level of 3, which is what I would call this patient. We're also going to say that they don't meet any of these danger zone vital limits. So we're going to give this patient an acuity of a 3. And now you'll see over here there are no red asterisks anywhere. So we are good to go ahead and green check mark this. This is going to sign this form and save it to the patient's chart permanently. You can go back and make modifications to that, and I'll show you that here in just a minute. So then once we've saved that, it automatically popped up the triage 2 window here because I clicked document on both of those. So this would be a good place to do any pre-arrival treatments done by pre-arrival crews, EMS. I'm going to say this patient has no advanced directives, no domestic concerns. They are 18 or older, so that's going to pop up our patient safety screen. Now, normally when the patient is not here for these reasons, for depression or psychiatric needs, I'm just going to say no. I'm going to answer that they are not depressed, none of this, and then back out of this. No human trafficking things observed. A lot of the time, patients are not going to know their immunization status. In that case, we can click unknown for now, and then we can go back into that immunization tab and import their record if they have one available. And then we can go back and modify this later if we need to. This patient is not going to be a fall risk, but fill this out appropriately. And their social history needs to be documented. So if any of these over here has a red asterisk, that means you won't be able to save this into the chart until you've documented something. So there's nothing documented here for alcohol history use, which is okay, but you're still going to need to ask the patient. The patient says that they have a couple of glasses of wine a month. We're still going to go ahead and click current use of alcohol. And that's just going to pop up this assessment here. We're going to ask the questions, fill this out appropriately. Anything greater than a 2 in this box is a positive CAGE score, and that's basically just telling us that we probably need to let our physician know this patient might eventually need a CWA score. Okay. I'm going to back out of that again. Now, if the patient is coming from anywhere other than home, make sure that we're selecting the appropriate living situation here, especially our nursing home patients. Make sure that we're putting in which nursing home they're coming from or assisted living. Then our females of childbearing age, make sure that we're filling this out even though it's not yellow, it's not a hard stop. We should always be filling this out. We're going to fill out these things that we have done for the patient, and we're going to select this care of all patients plan of care. Now, no red asterisks over here, so we can green check mark and save this into the chart. Now it's going to automatically pop up this ED assessment. So we're going to click document, and that will take us into the patient's chart. And it automatically pulls us into this interactive view where I said most of our charting would be happening. So our focused assessment, we're going to say, let's put in a couple of things here. Shortness of breath at rest, they're unlabored, not retracting. We're going to listen, clear in all lobes bilaterally. Then I'm just going to save that. Now, if there was something that you missed here, you can always go back into the ED as adult systems assessment and find your respiratory, find your appropriate body system, and then go back in and chart whatever it was that you missed. Then also over here we have our pediatric tabs. So there's our condensed view. And our condensed view tab, this is where we would be charting vital signs, pain assessment. This is also where our restraint charting is. And this is also where we would chart our CT safety screen and our MRI safety screen. So this would be for those patients getting contrasted CT exams. I'm going to double click that blue bar at the top to expand everything. And then we want to chart all of the answers to these questions before we take them to DI for their CT. Then of course our assessments. This is our different systems. And it's the same basic concept for our pediatric bands here. Then in your lines, devices, and procedures tab here, this is where you're going to chart your peripheral IV placement, your central lines, ET tubes, surgical drains and tubes, orthopedic, if we splint a patient, if we put a knee immobilizer or something on a patient, that's all here. Our catheter placements, that's all in this tab. And those are the ones that we use the most frequent. Over here though as well, you're going to find several other ones that we're going to open and look at. Let me show you here though quickly while we're still in this where we would chart an IV. If you've never used Cerner before, we have what we call dynamic groups. So if you'll notice, earlier I could expand all of this by double clicking on the blue bar. That does me no good. It gives me no IV options. So with these dynamic groups, you'll always see this little icon right here. You're going to want to click that. Then we put in a right AC over the needle 20 gauge. Now that'll pull in your IV charting so that you can chart what you need to on the IV, chart your reassessments on the IV later on. And there are several things that work that way in Cerner. Our Foley insertions are also a dynamic group. Wound charting is a dynamic group. So let's go into, I'm not going to save that. So our procedure sedation. So if we have a conscious sedation, all of that charting is here under that band. And that's something that we will orient you more closely to during your orientation with your preceptor on the floor. Our trauma assessment band. So this is where we would chart any trauma patients. That's also something that we'll talk about a little bit more closely during your orientation. There's an intake and output band here if you wanted to chart any of that. We don't do a lot of this in the emergency department either. There's a band over here for our cardiovascular chest pains. A lot of this is duplicate charting from our adult systems assessment cardiac charting option. The only thing that's really different here is when this is a STEMI patient and we call a STEMI alert overhead, that's where we would chart this, our MI alert activation. And this is another one of those things that we'll cover a little bit more in depth during your orientation. And this is sort of a similar story here. This would be for our neuro patients with stroke symptoms. A lot of this is duplicate charting from our neurovascular option up here in the adult systems assessment. This is just a little bit more streamlined. Then our handcuff assessments for patients that are coming from local detention centers. This is a little bit easier charting than our restraints, which is why this has been separated out. Then our wound charting. So any kind of wound is under this whole separate band here. And again, this is a dynamic group. So click that little icon. We're going to say and we can't say whether it's left or right, so we're going to leave that. And we're also going to call it multiple scattered. There's more than one in that same area. And click OK, and it'll bring up your charting here. Now from here, once you've entered this abnormality type, then it will give you the appropriate options to chart the rest of this. So we're going to say this is a pressure injury. Then it will give you options to wound stage. This is another one of those things that we'll go into more depth with during orientation. So now let's look at how we would chart medication administration on this patient. So up here at the top in our toolbar that we looked at in the first video, there's a medication administration button. Bring that up. You're going to want to scan the patient's wristband. I can't do that for you. I don't have a scanner attached to my computer, so I'm going to show you the back way here. We shouldn't be doing this, though. We should be scanning every time. So this patient has no medications ordered, but if they did, they would be here, and you scan those meds, and then you can chart them from here. Sign them. Let me open another chart so that you can actually see that. Let's see which patient has an order. This one in room 14. So back up here to our medication administration button. You're going to scan the patient's bracelet. Now you'll see that the medication option is here. When you scan that bag of saline, it will check mark this and bring up a window to chart the details, which site you're using, which number of bags it is. Click OK and sign. Now let's look at our specimen collection. That button is also up here in your top toolbar. This is also something we need to be scanning our patient's wristband for. So we're going to scan the wristband, and it'll bring up our collection options. So from here, it brings up your lab work all individually. So if you had several things ordered, you would see your CMP, your CBC all individually right here, and they would all have this little drop-down menu where you could print that individual label. But if you're going in to start an IV and you're doing all of this lab collection while you're doing that, you just want all of these labels, go up here to the top, print all labels. Then you can select your printer the very first time, and then you want to make sure you're setting that as your default. You'll never have to find that printer again. Print, and then there you go. This is also how we're going to collect these. So again, if you weren't able to get all of the tubes that you needed, you just need to collect certain ones. Go over here to your drop down, mark collected on the ones that you were able to obtain. And that gave me, I'm going to reset that. That gave me a pop-up warning because I didn't scan these. But if you have pre-printed your labels and you took them in with you and verified with the patient, you should be able to scan your actual labels for all of these. I can't show you that again though. So it'll give you a warning that says it's not been verified by a scan. Would you like to continue? So then you can click sign. And then that removes that from your options of things to be collected. Now let's go over and look at our patient discharge. So back in our ED nurse workflow, we go to our ED nurse discharge tab here. Now most of our providers while they're putting in their discharge orders. We'll go ahead and fill out our follow-up and our patient education for us. If they don't, you'll know you can't do any of this, can't save this disposition into the chart with the red asterisks. So we need to put in a follow-up. Just click that and it'll bring you right up to the follow-up here. And you're going to click the add button at the top right. We're going to say follow up with primary care and sign. Then that'll give us a green check mark. Same with our patient education. If you click on that, then you want to come up here to the drop down and add new custom education. We're just going to click a couple of them. Let's see, diabetes, double click. There you go. Oh, did one too many times. Then sign. And again, green check mark. So most of the time when you come in to print out your discharge paperwork for your patient, the provider will have already filled this stuff out for you and you should already have green check marks. You will have to fill out your IV stop times. If you just click on that, then you're going to click document. Select your IV fluid here. And we gave 2 liters. So this first one we started at 1254. Second one we started at 408. And we're going to say we finished it now. It's not been an hour, but we're going to pretend for now. Go ahead and sign those. Now you get the green check mark here. Fill out your discharge disposition. Click on that, and then again up here with the drop down, ED disposition summary. Now this first window here, this is our immunization charges. So if you give a patient a tetanus, you're going to want to just chart that you gave them 1. It's always our initial. If you gave a RhoGAM shot, that's our immune globulin, you're going to chart 1. And that will just drop the charge for that. There's nothing here that's a hard stop in this assistance summary on the second tab. If you did any of this, you can go ahead and select that though. Then you'll see there's a red asterisk here next to that disposition. This is a hard stop. We have to fill this out. So you're going to chart your discharge statement, even though it's not yellow. You can, if you just recently did a set of vitals, you can go ahead and just click here, see nurse's note. Otherwise, put a new set of vitals in down here. Then it'll make you do your Glasgow Coma scale every time. It's also going to make you put in a pain assessment. Then, because when we did our triage, we selected this care of all patients, care of plan of care, we can click that again that we met that discharge outcome. Hard stop, patient doesn't have an I-post, we can click NA. We're not going to chart any critical care time for this patient. So critical care time over here, these are a list of examples of indicators for critical care time. Usually we say if it's something that we feel we can't leave the patient's room for 30 minutes or more, we would chart critical care time. We can't leave that patient's room because if we leave the room, something bad might happen. That's critical care time. So we have a patient that's on vasopressors and not doing well, and we haven't been able to leave that patient's bedside. 30 minutes of critical care time. We were stuck in that room because of this. Most patients, we're not going to be able to chart this. So we're going to just go ahead and chart 0. Then down here, if we're discharging the patient home, click yes there, fill out all of this required information. We're not sending any prescriptions. We're sending them home independently. They're ambulatory. None of these major procedures while they were here. Then you'll see next to our ED disposition tab here, our red asterisk went away and now we have a check mark. So we could save it here. Let me show you though, if we were transferring this patient out, then we click yes here and we get this pop-up window where we need to fill out this information. If we're admitting this patient, we don't get a pop-up window. We just click yes here. Then we can save this. Now we have a green check mark here. So now that everything is green check marked, you can go ahead and click discharge instructions, and it's going to auto-populate all of those things that we just filled out. The patient education, the tests that we did, our diagnosis from the visit, our follow-up should go in here, and their current med list. So then you're going to go ahead and sign and submit if it all looks okay. Sign and print. Then you can print this out, have the patient sign it. Now let's say, let me back out of here and go into another patient's chart here really quickly so I can show this to you. So this patient, let me just do a quick follow-up. Physician put all of this stuff in for us. They didn't have any IV fluids. We don't have any stop times to chart here. You don't have time right now though to print this or to fill out this disposition before you print the instructions. That's okay. It's just going to pop up a warning. Go ahead and click that and it's going to say we're overwriting it. Why are we overwriting it? Whatever is applicable here. So patient's been recently assessed. Submit that. It's going to still allow you to go ahead and print out those discharge instructions. You'll just need to go back in when you have a minute and complete that disposition. So back to our other patient here. We have given them their discharge instructions and had them sign, and they are leaving the room. If you click down here on discharge, or if we were admitting the patient, we would click here, and I'll show you the differences. We click discharge. It's going to give us a pop-up window. Pay no mind to that one. And this would normally be already filled out. All you need to do is put in here these yellow hard stops. So we're discharging them to home today, now. You're going to complete that, and that is going to remove this patient from our tracking board. Let's go back in though and look at the admit window. So we're going to admit this patient. So we are going to admit them as an inpatient, and we're going to do that right now. And you'll notice that these all have the red asterisk. We have to fill those out, otherwise it won't let you save this. Go ahead and complete that. And that's going to do the same thing. That also will take them off of the board. You can see that patient was here in 14. That removed them from the board and automatically tells us that this room is dirty and needs to be cleaned. In order to change that, if you just click here, let's click on this one since we already have a dirty room. It's cleaned. You need to change it back to a clean room. Left click. You can either mark it as available or just click none. These other options here, we don't ever use this assigned option, but we would hold a room for if we were down to only one open room. A lot of the time we will hold that empty room for an ambulance, or if maintenance was coming up to work on something in a room and we couldn't put a patient in there, we would just mark it as out of service. Then once they're done, you go ahead and just change that back to none. That lets us know that this room is available for use. And I think that that's all I have for you. Any other questions can be addressed with your preceptor or anyone in the education department. For the emergency department, I am your primary educator, Bree Carlson. You can get a hold of me during daytime hours at extension 4005, or you can send me an email or a halo. Either way,